Ever had one of those, nagging toothaches, that feeling that just distracts you from everything?
Oh, yeah, absolutely. Sends you looking for help fast.
Exactly. Well, today we're diving deep into one family's quest for exactly that good, affordable dental care.
Mhm.
And this journey, it takes us not just across town, but from the UK all the way to China.
Quite a trip for a tooth problem.
It really is. And this whole deep dive is based on a fascinating personal story shared by one of you, our listeners. It's really vivid, full of details, direct comparisons, and it shows some, frankly, stark differences in dental experiences, costs too, and efficiency.
Right.
So our mission today is to kind of unpack this family's journey. It all started with their son's dental issue, and we get to see just how vastly different two healthcare systems can look, through their eyes.
And what's so interesting here, I think, is how one specific case, the single story, can really shine a light on these bigger themes, like healthcare access, cost, efficiency across borders. It makes us ask, what do we actually prioritize when we're seeking medical care? What defines these systems?
Absolutely. So let's start at the beginning. It involves a young boy, Ethan, and this recurring tooth problem. Something lots of parents can probably relate to. As the parent tells it, it all starts with a visit to a dentist in England. Okay, standard enough. But then Ethan was told, quote, everything was fine, no problems whatsoever.
Oh, dear.
Right, can you imagine? You see a professional, you get reassured, but the problem just keeps happening. That must feel, pretty confusing.
It really must. And that initial diagnosis, that's such a critical point, because when a problem hangs around even after a professional says it's okay, well, it's not just frustrating, right? It often pushes families to get a second opinion or look for other solutions entirely.
Exactly. It kind of highlights that challenge in diagnostics. Even with the best intentions, maybe different approaches or, limitations in one system mean something gets missed.
Precisely. And that seems to be what happened here. It propelled the family to look elsewhere.
And that's the turn in the story. The tooth problem wasn't solved. That first diagnosis didn't hold up. So the family made a pretty big decision.
To seek treatment abroad.
Yep. A journey that ended up shedding light on a totally different approach to dental care. Their destination, a hospital in China.
Okay. Why China specifically?
Well, it wasn't random. The parent mentioned hearing good things, that dentists there were considered fantastic. So they get to this hospital, ready for Ethan's appointment.
Right.
Check-in starts. Seems normal, but then, a snag. The parent recalls they'd run out of registration places to see the dentist.
The dreaded no appointments available. That can really sink your hopes, especially after traveling.
Totally. Especially when you've come so far.
It's a common issue, isn't it, in high-demand systems? Managing that patient flow is always a challenge.
But what's interesting is how they got past it. It wasn't just a dead end. No, because here's where they caught a bit of unexpected luck. A lucky break, you could say. Instead of just leaving, they decided to talk to a doctor anyway, maybe just for advice.
Resourceful.
And guess what? The doctor comes back and says, my son has got one more space. They've kindly given one more space for my son to go and see.
Wow. Okay, so a bit of flexibility in the system.
Exactly. The parents sounded so relieved, so grateful. Described the system as so accommodating and so helpful.
And if we zoom out a bit, that moment, it really shows something interesting about patient experience, doesn't it? Even in big systems with queues and rules, sometimes there's room for, human intervention, a bit of flexibility to find a solution. That adaptability can make patients feel really cared for.
Yeah, it shows that even big systems aren't always impersonal. And sometimes you just need a bit of luck.
A bit of fortune, yeah, it can make all the difference.
That moment definitely set a positive tone. But okay, let's get right to the numbers. Because this is where the UK versus China difference just becomes, incredibly clear. For just that initial consultation in China, the family paid only 18 Chinese yuan.
18, okay.
Which is roughly, £2 British pounds? Maybe a little more now, but around that. Just £2.
Wow, that's strikingly low for a consultation.
Now compare that to the UK experience they mentioned. The parent explicitly said that in England, a similar first visit could be anywhere from 12 to 15 pounds.
12 to 15 pounds.
And that's before you pay for any prescriptions on top.
Right.
So we're not talking a small difference here. It's a huge contrast in just the basic cost to get seen. China was significantly cheaper for that first step.
That immediate affordability, it does suggest something about the system, perhaps. Maybe optimized for high volume, standardized procedures, or maybe state subsidies, different economic models for healthcare. It's certainly a contrast to the sort of out-of-pocket fees or insurance costs you often see in the UK, even just to walk in the door.
Yeah.
For anyone listening, those specific numbers really bring the financial side into sharp focus.
It really does make you think about the direct cost burden. And actually, on a sort of interesting side note, while they were navigating the hospital, the parent came across a word they'd never heard: stomatology. They actually said, I'd never heard of that.
Stomatology. Yeah, it's not a term you hear every day in, say, the UK or US context, correct?
Yeah, it sounds quite formal, more than just dentistry. The parent even broke down the Chinese characters: ko for mouth, shang for cavity, si for study. Makes sense, they said.
And that linguistic detail is quite telling, actually. Stomatology usually refers to the study of the entire oral cavity.
Oh, okay.
So not just teeth, but the mouth, jaws, all the related bits. It hints at maybe a broader, more holistic view of oral health within that medical system.
Interesting. More than just drilling and filling.
Potentially, yeah. It's a subtle difference in framing, but it's there in the language.
Okay, so consultation done, lucky spot secured, new word learned. Now was actually time for Ethan's treatment, the main event.
Finally getting the filling.
Yep. The parent says, it is time for Ethan to have his filling. This was the moment they'd traveled all that way for.
The resolution.
And the outcome.
Well,
Sticking with the theme, it was incredibly efficient.
very.
And the cost, get this, the total cost for the entire treatment is 287 Chinese yuan for full filling, x-ray treatment, and medication afterwards.
287 yuan for everything. Filling, x-ray, meds.
Everything. It's all sorted out, all paid. That's roughly 31 British pounds.
31 pounds for the whole package. That is remarkable.
Isn't it? A full package deal, diagnosis, treatment, meds, all wrapped up for what seems like a very low price.
Astonishingly low by UK private standards, certainly.
It's maybe the best part. Ethan's reaction. They asked him, how easy was it, Ethan? How long did it take? His reply, super happy, really super easy.
And that's huge, isn't it? Especially for a child. That patient comfort, the feeling that it was easy, that positive experience, quick, maybe relatively painless, that can make such a difference to how someone feels about dentists or doctors going forward.
Definitely less anxiety next time.
Exactly. And the fact that the whole process, payment, meds, everything was handled so smoothly, no apparent complications, that adds massively to the overall satisfaction for everyone.
Absolutely. That patient experience, especially for a kid, it really can shape future attitudes. Okay, so let's bring it all together, because the comparison the parent makes between the two experiences is just, well, stark.
The final verdict?
They summed up the whole China visit like this: we've been in and out within 2 hours.
2 hours, a total.
Total. Ethan went in, was seen very professionally, very efficiently, very quickly. It took a matter of minutes for his filling to happen.
Minutes for the filling itself. Wow.
Now, compare that to the UK experience they mentioned earlier. The parent didn't hold back. Quote, whilst we was in the UK, the process and the amount of time that it took was ridiculous.
Ridiculous, that's a strong word. It really speaks to the level of frustration they must have felt before.
It really does.
And this whole story, it just powerfully illustrates how different systems might prioritize different things, right?
The Chinese experience here seems heavily weighted towards speed, efficiency, cost-effectiveness, at least for this procedure. And for a patient needing a quick fix, that's a massive relief.
You can hear the relief in the parent's voice, describing the professionalism relative to the cost as incredible.
Yeah, the sense of gratitude, that feeling of problem solved efficiently and affordably. It shows that low cost and speed can go hand in hand with a positive patient experience, at least in this case.
So, wrapping this up, what does this all mean for you, listening? This deep dive, it's given us a really close look at how a simple dental problem can spark this journey across continents and reveals these huge differences in cost, speed, and how the patient feels about it all. It's quite a story of finding a solution where maybe they didn't expect it and at a price that clearly amazed them.
It brings up that important question, doesn't it? When you think about your own healthcare needs, what parts of this story resonate most?
Yeah, what stands out? Is it the speed, the low cost, the feeling of professionalism? What do you see as the most desirable thing in a medical situation? Because every system has its trade-offs, its strengths. And the story really highlights how one system's particular strengths, in this case, maybe efficiency and cost, can be exactly what a patient needs at that moment.
And maybe a final thought to leave you with. How much of our idea of good healthcare is really tied up in things like speed and cost.
Versus other things.
Yeah, versus things like maybe the initial diagnostic accuracy or having continuity of care with the same provider, or even just the cultural expectations we have around getting medical treatment.
Good question.
And how might one single really positive experience, like Ethan had in China, change how we view healthcare systems globally? Does it make us look beyond our own borders more readily?
Definitely food for thought. How much does one anecdote sway our perception of vast, complex systems?
Something to mull over. We'll leave you with that until our next deep dive.